Hi, I'm Dr. Larry Meyer. You're going to see a typical experience of a LASIK patient here at the Green Bay Eye Clinic. The day of surgery, a patient reports to our LASIK offices. They are brought into a preoperative room. There they get instructions and are given drops before the surgery.
I'm ready, I think.
When that's completed, the patient is brought into our refractive surgery suite and they are first positioned on the bed and positioned under the intralase. The intralase is the laser that's used to create the LASIK flaps. Once the patient is positioned under the intralase, I let them know what to expect. The flap is created first in the right eye, followed by the left. The first step is to place a positioning ring and to then, we call it dock the intralase cone onto the cornea. The laser is then applied very rapidly. Each very tiny laser pulse creates a burst of energy and creates a carbon dioxide bubble. These will coalesce together and actually create a cleavage plane of the superficial corneal tissue, and that is what is used to create the flap. These flaps are very thin. They generally measure only 100 microns in size. That's about 20% of the overall corneal thickness. But they are a very thin wafer of corneal tissue. They are left hinged along the top portion, so that when the surgery is performed, the flap is reflected and the actual laser treatment is then done. Once this procedure is performed, as you can see, the bed will rotate into position, now under the actual treatment laser. At this point, the patient's ready for the treatment. Some preparation of the eye is performed. We use betadine to clean around the eye, and then some drapes are placed. The right eye is always performed first. The flap is then lifted and the actual laser treatment is then placed underneath the flap or onto the corneal tissue. This laser then removes corneal tissue selectively to create the treatment effect. In a nearsighted eye, more is removed from the center and less from the periphery, thus flattening the cornea. Our laser treatments are very quick today. They generally range in time from only about 5 to 20 seconds. Once finished, then that flap is then repositioned and it's smoothed into place, making sure that it is properly aligned. The right eye is done first and immediately followed by the left, where the same procedure is performed. When finished, we then have the patient sit up, hopefully enjoy the fact that they are seeing better already, and bring them to an exam room so they can be looked at and given instructions.
Just a little bit of blurriness right now, but other than that I can pick out things already in the distance clearly.
I tell them that there are going to be some eye drops they are going to need to use. There are two in particular, one an antibiotic and one an anti-inflammatory steroid. We generally have them use these drops 4 times daily. It is important to use a lot of lubricating artificial tears initially. Blinking is a good thing for the patient. We actually ask them to not sleep initially, as it is believed that that helps the flap to adhere and become clearer more quickly. Some goggles are then placed over their eyes for protection, and they are generally then on their way home. The patient is then always seen back the next day in our offices. We want to ensure that their vision is good and that they are doing well. It's pretty typical on the first day after surgery for these patients to see 20/20. The vast majority of them do. Some are not quite at that level, and there is continued improvement over the course of time. I will take a look at each eye and make sure that the flaps are clear, smooth, and well positioned. We then go over further instructions. That includes use of eye drops for up to a week and some ongoing use of artificial tears. I tell every one of these patients that they can experience some dry eye, they may have some halos and glare at night, and can have some fluctuating vision, especially early on. but these are symptoms that typically improve over the course of weeks.
It was quick, it was relatively painless, it's exciting, and it's neat to see how it all comes together, but you know, in the end what it did for my vision is awesome. So it was everything I thought it would be. I trusted the doctor. He had a great reputation for doing this type of surgery, so I didn't feel really all that nervous. From the initial consultation, I felt very, very confident after I talked to him, and then the way he talked me through the surgery made me feel very comfortable. And even with a late night call back from the doctor to check up on me to see how I was doing, I thought that was very nice, very professional. Within an hour and a half to 2 hours, it was just basically a little bit of graininess feeling in the eye, but certainly no discomfort that you couldn't live with. To get up this morning and to be able to see everything immediately and no pain whatsoever the next morning, that's very, very cool. Awesome. As an avid golfer, you can't wear contact lenses, which I preferred to wear when I golfed because wind would dry them out immediately. So this, I'm hoping, will definitely replace that. Like so many other people, I keep wondering why I didn't do this 10 years ago. But now that I've done it, it's fantastic. I'll be honest with you, this office, Dr. Meyer's entire staff, from the very first day I came in for consultation, or the first day I even called to inquire about it, I would say everybody here has gotten me through this process incredibly quickly, expeditiously. I would come back here, or I would recommend Dr. Meyer and his entire staff to anybody at this point. I mean, it really was quick and painless and interesting, and here it is done already.